research I just completed, which had interviews with 21 health executives, points to an early market. A lot of the work being done in hospitals and healthcare organizations using voice technology is, at this point, I would call it experimental and pilot. And we'll see, and some of the pilots have been running for several years. There's some pioneers in this, Children's Hospital in Boston and Mayo Clinic. They got started in 2016 and 2017 because they believed there was an opportunity to create a better experience for patients and care providers. And I think that has come to pass, and they've expanded their work. And there's a lot of information in the report, Voice Health and Wellbeing 2020, which is on the website ageandplacetech.com. The overall market for voice technology worldwide is projected to be $49 billion. Voice first has become a phenomenon in the past 3 years. And what we have specifically in the health space is a big change. It was announced fairly recently that Amazon has assisted with technology to make voice skills HIPAA compliant. And that actually came to pass, and 6 skills were announced as part of that project. So what do we see as a potential in the voice technology market for healthcare and healthcare providers includes, and is not limited to, voice-enabled medical notes. That is, doctors no longer have to wait till the evening to type in the information from their interactions with patients. Voice-based patient education, voice-enabled hospital rooms, physician charting during visits to potentially over the next few years replace the 17,000 scribes that actually stand there taking notes while the doctor is speaking. The ability to fill a prescription by voice, one organization is already enabling that. The ability to use at-home wellness technology to both monitor your own well-being and find out tips and guidance about how to be healthier in your home. You can also search by voice these days. You can get assistance. You can find the nearest urgent care. You can find a hospital. You can look for a ride to the hospital. All of these are part of what I would consider to be the phase we're in right now, which is experimentation and pilots. But the reason this is so exciting is the organizations that are doing the experiments and the pilots are themselves excited about the future potential. So with that, I'm going to introduce one of our 2 panelists today, Stuart Patterson, the CEO of Lifepod. Stuart is the co-founder and CEO of Lifepod Solutions, a pioneer in the provision of voice-first virtual caregiver services. Stu has led high-growth ventures in a variety of markets, including voice and virtual assistants and caregivers, speech recognition and synthesis, and natural language understanding, which he probably likes to call NLU, as well as mobile and online apps and services, video content, identity management, clean tech, and digital healthcare solutions. So with that, I'm going to turn it over to Stu to talk to you about what Lifepod is and is doing. And we're going to start with a question. Can you tell us about Lifepod and what the company does, and how is that different from other voice-first technologies?
Sure. It's a pleasure to be here, Lori, again with you. And thank you for publishing such a great report. It's an important step, I think, in the industry's history and progress. So Lifepod has taken a step in the land of healthcare, emphasizing the word care. We believe that to care for someone means you must be proactive. You must act and go help them, call them, write them a note, check in on them. And in order to do that with voice technology, the voice technology itself also has to be proactive, meaning that the speaker, in this case the smart speaker that can talk to them, talks to them before they talk to it. Now that's really turning the telescope around on the voice industry. I've been in the voice industry, and many of my colleagues have been in the voice industry for over 20 years. So we've seen many waves, and the most exciting wave now, of course, is the smart speakers brought to us by Amazon and Google and Samsung and Microsoft. But all these smart speakers are self-service. I wake it up, and then I ask it for something. So it reacts to me. It's not proactive. We did a trial with a major healthcare organization in Massachusetts. I know that's one of the next questions is, what have we done that's very exciting? And you talked about pilots being in the pilot phase. We did a trial where we set up among 50 of the dual eligibles, those on Medicaid and Medicare. So they're the most expensive age and population in the healthcare industry. And we put Lifepod capable devices in their homes. And then the caregivers, professional caregivers, or they call them care partners, set these up with check-ins that would say, "Good morning, Leanne. How did you sleep last night?" And then it would wake her, or they would talk to her a little later and say, "Good morning, Leanne. It's just after breakfast. Did you take your 2 little red pills yet?" And that's the kind of proactivity that Lifepod enables for the first time. And that is set up by the human caregiver. So it's not all based on artificial intelligence. All voice processing is based on artificial intelligence, so it's hard enough. But putting the human element allows it to be proactive, allows the routines that support the patients in their homes throughout the day to be completely personalized. So it's only talks to them about the things that they really need and want to talk about. And that's the next important point, is that it's holistic. The social determinants of health is a very, very, very important concept. There are studies that suggest that medical treatment only accounts for 20% of recovery, and that the other elements of health, called the social determinants of health, account for the other 80%. Well, that means you have to make sure they're not lonely. And what we found in this pilot of these 50 patients in their homes was that by interacting with them 9 times a day, an average of 9 times a day, and asking them if they'd like to hear music, asking them if they've gotten their exercise because that's important to their care plan, that these social determinants were also accounted for. So that's a quick overview of how Lifepod works. We think, we know, because we've just won major awards from people like Florida Blue and from Advocate Aurora. These people have millions of patients. The pilot that we did was only 50. But the other thing I want to add, and then I'll let you move on to the next question, is that because of the success, we had incredible success. The care partners who set up these routines to talk to their patients during the day said 100% of them would recommend it to another physician or nurse practitioner or whatever to do the same thing with their patients. And 96% of the users are still using it 9 times a day, 1 year later, satisfactorily. And so they're rolling out 500 now in production. So it's no longer a pilot. Okay, we're moving into real production level rollouts to healthcare patients, we hope around the country, obviously.
So one aspect of what you just said made me think about the efficiency factor for staff who may not have to approach the room for every interaction with a person. Mm-hmm. Is that a factor in this?
It is in a campus or an institutional facility. What makes Lifepod particularly powerful is that we can go into somebody's home. And so the efficiency factor is definitely a factor in a hospital or a healthcare institution that cares for people in their home and monitors them, because they don't have to visit as often. Right. And they don't call as often into the professional healthcare sort of staffed call center. Right. And so that saves them resources, and they actually did measure exactly those 2 metrics, and they got more than a 5% improvement in efficiency. In fact, 25 to 50% improvement in efficiency. And so that was sort of, it paid for itself almost.
Right. I think sometimes you have to rationalize and justify the use of a technology, even though the benefit for it can be very social and yes, improve the caregiving experience.
But in senior living facilities where we're also deploying, we're in fact deploying 101 senior living facility, so they're going into production as well, since we launched only in production in November. They have the same point. But their big benefit is improving communications between their residents and their families. That is the holy grail for senior living facilities now. And Lifepod, because the families are often setting these things up to check in on their parents and support their parents, they just love it.
So talk a little bit about future areas that you would like to address. How would you like to see what you call proactive voice used in potentially other healthcare areas?
Well, we are announcing at the show, in fact, yesterday we did a press release with a company called Mobile Help. And they're a specialist, in fact, they revolutionized the personal emergency response marketplace, which is the pendants that people wear in case they fall, and then they press the button to call for emergency help. What we announced today is that we are able to demonstrate, and I encourage anyone who's interested, they can go to Mobile Help's booth or suite, they can go to iHome, which manufactures a smart speaker that Lifepod runs on, and they can see a demonstration where a person can now call for help. So if they leave the pendant on their dresser and then fall and can't reach it, and this happens surprisingly a lot of the time. So that demonstration is being done now. It's in the press release that we put out yesterday, and we are hoping to have that ready for production, and meaning all regulatory approvals, et cetera, by Q3, and that's a major improvement in the ability of voice-first interactions, and the voice interface is so natural and so powerful that means that people will be able to get help, but also get the help they need. So that what you'll see the demo is it says, when you say, Lifepod, help me, I've fallen, it says, do you need emergency help now, emergency medical relief now? If you say yes, you immediately are talked to by the Mobile Help call center person. If you say no, it says, oh, I'm glad it's not an emergency. I will send a text message to your primary caregiver on their cell phone saying you called for help, and they can contact you. So I think that's a big advantage. One other advancement in the voice field specifically that we met with Amazon about last night, very, very exciting for those of us who've been in voice for a long time, is what they call the Voice Interoperability Initiative. And that is going to benefit the healthcare industry in big time because it allows Lifepod to sit right next to Alexa. And they call it dual wake word. Jeff Bezos himself came out and said, this is the right customer experience. And because of that, we can do that kind of emergency help response that I just described separate from Alexa. And so they don't have to deal with it because right now you can't ask Alexa for help and get it. And so this is the kind of opportunity that opens up, having Alexa be separate from a system like Lifepod. They did one with Facebook on the portal, and they did the dual wake word also recently with Salesforce with their wake word called Einstein.
Excellent. Sounds like you're making enormous progress, and it's a pretty exciting category, and we look forward to what happens next. I think this is the end of our component.
Yes.
So
thank you.
Thank you.